who is the Associate Director of Clinical Affairs for Simmons Cancer Center. Thank you so much for joining us today, Dr. Sweetenham.
Thanks for having me.
Well, today we're talking about COVID-19 and cancer. And so I guess we'll just jump right into our conversation. My first question for you is, what do cancer patients need to know about COVID-19?
I think the most important thing to be aware of is that if you have a cancer diagnosis, you are a little more at risk of developing COVID-19. And you're also somewhat more at risk of getting sick from COVID-19. So those are very general statements, and I think it's important to put them into some context. You know, we're still learning a lot about COVID-19, and most of the information that we have so far about the implications of COVID-19 for cancer patients have come from information that's come out of China. And also, there is a little bit more information emerging now from centers in the US, especially from New York, where they've had more experience than anybody else. So in terms of how big the risks are for cancer patients, we're not really too sure, but what we are fairly certain of is that the risks are higher than for the normal population. So, you know, we know, for example, that folks who have a diagnosis of diabetes are more at risk from COVID, people who have lung disease, and we would add cancer to that list. And then I think maybe the final thing I would say about that is the amount of risk you have depends on where you are in your cancer journey. So folks who are on active treatment probably are the ones who should be the most cautious in things that they're doing. Those who are cancer survivors and perhaps many years out from treatment, you know, certainly have a risk which is probably very similar to folks who've never had a cancer diagnosis.
Okay, so what kind of risks do cancer patients face that perhaps the average person might not, as far as we know?
Well, as far as we know, it's really two things. First of all, as I mentioned before, the chance of actually picking up the virus in the first place appears to be higher. Again, exactly how much higher, we're not really sure yet. But if you do pick up the virus with a cancer diagnosis, then the early information that's coming from China suggests that folks with a cancer diagnosis who develop COVID-19 have a risk of becoming sick from it, which means that the risk of needing to be on an intensive care unit is probably about 3 times the risk in folks who don't have cancer. Now, again, to put that in proportion, the overall risk is very low. So I wouldn't want, you know, folks who are experiencing cancer right now to be overly concerned, but they should be concerned and careful, I think, is the bottom line, because the risks are higher.
Okay, you know, and you saying the risks are higher, I do have a question about that just came in. Is it safe for cancer patients to go to clinics and hospital locations for treatment while COVID-19 is going on?
Short answer to that is yes. I'll tell you a little bit about what we're doing here at UT Southwestern, which is really very comparable to what's happening in other cancer centers all across the country, actually. That is, first of all, our advice to anyone who is concerned is, first of all, if there isn't an absolute need to come to the hospital, then we are, you know, going to be suggesting to you that you don't come. So the best thing to do wherever possible, and one of the things that we've been doing pretty extensively, is arranging virtual visits for our patients, so that if folks have follow-up appointments with their physician or with their other provider, we're trying to do as many of those visits as we can as virtual visits over a telehealth platform, so through your smartphone or through your desktop computer, and we can set that up so that you and family members or other caregivers can be a part of that. For those folks who do need to come to our cancer center, and the number of patients who will actually be coming in is probably going to start increasing from now on, you can be reassured that we screen everybody for symptoms when they arrive at our cancer center. We actually call our patients the day before their visit to check that they're not having any symptoms. There's a screen with a questionnaire and then with a temperature check when patients come into the building to make sure that they don't have a fever and to make sure they haven't any of the risk factors for COVID-19. And then when they're in the building, we've worked very hard at social distancing. We require everyone to wear a mask. Patients and staff all wear masks now. And then anyone who's coming into our building will see that we have social distancing practices in our wait areas. All of the waiting spots are more than 6 feet apart. And if we had anyone who does test positive or has a positive screen when they come in to the building, then we have procedures in place to make sure that those patients get tested appropriately and to limit the exposure of anybody else in the building to those folks. So
okay, it sounds like we have a lot of safety precautions in place to make it as safe as possible. This kind of leads me to another question. What treatments are available, or what options are there for cancer patients who might also be COVID positive?
Yeah, so overall, we are trying wherever possible. We want to keep our patients' treatments on time, on schedule, and we've been so far able to do that for our patients who are coming into our infusion centers and our radiation treatment centers as they normally would. We've been fortunate here that we have not yet seen a significant number of patients with COVID-19 who are testing positive. For folks who are coming into some of our clinics now, we're routinely testing them particularly for certain types of cancers where we know that the immunity is particularly low. We're not routinely testing everybody right now, but if somebody who is due for treatment does test positive for COVID-19, then what we're learning is, that we have to strike a balance. On the one hand, wherever possible, we want to keep the treatment of our patients' cancer on time and on schedule. But we also know that if you are positive for COVID-19, if we treat you with chemotherapy or other cancer treatments, we do put you at greater risk of becoming sick from the COVID-19. So the balance that we need to strike is, on the one hand, there's a risk of going ahead with treatment and potentially making the COVID-19 situation worse, and on the other hand, delaying cancer treatment, which is something that typically we don't want to do. In general, our approach is, if somebody is COVID-19 positive, then we would normally plan to delay the treatment probably for a couple of weeks and then retest and plan to go ahead. But there are some situations where the situation with the cancer is sufficiently urgent that we would go ahead and do treatment. But for most people, we would strongly advise that we delay treatment for a week or two, retest, and then take another look.
Okay, so treatment might be delayed. We just got a question from Kristen here on Facebook, and she's asking, will test results be delayed due to COVID-19? So if a cancer patient has tests done, would those be delayed due to COVID-19?
You mean a test related to their cancer?
Yes.
Yeah, no, typically no. In fact, most of the regular laboratory workups that we're doing, imaging, X-ray, CT scan, and so on, those are all being done on time. So when a new patient comes with a new cancer diagnosis, or if we have somebody where we're looking to see how well they're responding to their treatment, those investigations are being done on time, and the results are being turned around in the same way that they usually would.
Okay, that's good news.
Mm-hmm.
What can people do to manage their fears around COVID-19 in this time? I know that you probably are getting a lot of questions from patients What are some of those fears, and how do you recommend your patients deal with those?
Yeah, I mean, interestingly, what we've experienced here, and I think it's been the same in many other centers. You know, I talk with colleagues around the country. What we've noticed most is that one of our patients' biggest fears is actually the fear of coming into our buildings and the risk of exposure in our cancer centers. And so, you know, we've worked very hard to address that. And then, you know, the next biggest concern, I think, for most folks has been what effect will delays in treatment have on their cancer if they've had to have a treatment delay. And so, you know, we've tried to be very thoughtful about that in the way that we have scheduled treatment visits and so on. And for the most part, we've managed to keep, you know, a big majority of cancer treatments on time. In fact, the treatments that we've typically delayed a little bit have been those which are treatments for bone strengthening, those kind of treatments, which don't directly impact on the cancer itself, but a part of the kind of supportive care we do. But I think that the biggest fear for our patients, as I said, has been coming to our buildings and concern about the safety of those, which we feel, you know, really very confident about. And obviously the reasonable concern that, you know, if I do develop COVID-19, am I at higher risk than somebody who doesn't have cancer? And as I've said, the answer to that is yes. You know, it needs to be kept in perspective that it's higher, but it isn't, you know, very, very high. It's just something where cancer patients need to be extra careful in terms of what they're doing.
So what about screenings? I know that you know, screenings seem to have dropped significantly during the COVID-19 pandemic. Are those screenings available now, or are there any limitations around screenings?
Yeah, so the screening rates during the height of the crisis a few weeks back, you're quite right, went way down. And I think it went as low as, it dropped by about more than 90%. And during the height of the pandemic, you know, which obviously is different from state to state, that's correct. That was the right thing to do without question, because, you know, folks would have been put at too high a risk by coming into the buildings. What's happening now, and again, I'll speak for us here at UT Southwestern, we are just beginning to get our screening programs back on track. And so we're starting with a gradual return of screening programs such as mammography, and those will be beginning within the next week or two, and then we'll start to ramp back up to full capacity as quickly as we can, which will probably take a few weeks. So what I would say is that for those people who are on today who maybe cancelled a screening appointment, or who decided that they would delay that screening appointment, I think that was a very good decision at the time to do that. But now I would recommend that, you get back in touch with us and plan on rescheduling that visit. It may still be a few weeks out because we have a backlog that we need to catch up on, but we are getting started again now.
Okay, so screenings are getting started again. Are caregivers allowed to accompany patients to appointments at Simmons, or is there a timeline for when that may change?
So at the moment, we are still asking for caregivers and visitors to refrain from coming into the building. We understand how difficult that is. And you know, I would have to say that as we've worked through the measures that we wanted to introduce here, to protect our patients and our staff from COVID, restricting visitors and caregivers was probably the toughest decision that we had to make, because we do understand that we're you know, that restriction just adds more stress to what's already an extremely stressful situation. But in the end, like cancer centers all over the country, actually, we decided that safety for our patients and for our staff was the sort of primary driver of that. So at the moment, we are still restricting visitors to the building. For those folks who want to stay in touch with their family member or the person that's taking care of during the visit, We have ways that you can do that through smartphone or through the phone so that they can be kind of virtually present during the visit. We have staff members who will accompany patients who need help to get around the building and make sure that they are in the right place. And there are some, exceptional circumstances where, for various reasons, a patient simply has to have their caregiver with them. In terms of how long that restriction is likely to last for, I think it's really a little too early for us to tell. Obviously, we will relieve that as soon as we can. But as we start to restore our normal services again, there are going to be more people coming into the building. At the moment, everything we know about preventing the spread of COVID-19 tells us that social distancing and reducing exposure are the most important things. So I would say there's no definite time for when we'll discontinue that, but I can only give a commitment that as soon as we think it's safe, we'll relax that restriction.
Okay, we're getting more questions in. Are there any precautions caregivers or loved ones should be taking above and beyond masks and hand washing?
So I think, in general, in terms of what things we can all do to reduce our risk, probably the most important things are social distancing for sure, masking when you're out is important, hand washing and hand sanitizers, and difficult though it is, and again, I think we all understand how difficult it is, minimizing how much time you actually are spending away from home. And really the precautions that we recommend for our cancer patients are really the same as for anyone else in the community. And the other thing I'd add to that is, if you know that somebody is obviously not well, a family member with a fever, then especially at this time, I would make sure that you avoid contact with them if at all possible.
What is the most important thing right now that you feel cancer patients or their caregivers need to know around the COVID-19 pandemic?
I think that the most important thing is that, from the perspective of the cancer itself, certainly I'll speak for UT Southwestern and the way that we've approached this here, that we've worked very hard to make sure that everyone who has treatment needs that are urgent treatment needs that have to be met, that we've been able to do that, and we've been able to do it safely within our building, with many measures in place to reduce the risk of spread. So I think what I want to do is reassure folks with cancer, especially if they're either at the kind of workup diagnosis stage or if they're in treatment at the moment, that we believe our buildings, our facility is very safe. We are able to treat to the level that we normally treat to, and that in terms of the general kind of progress through their cancer workup and cancer treatment here, for the most part, it would be, exactly as it would be normally. What the difference is, I think, at the moment, are that, we're trying to restrict the amount of time anyone has to be here in the building. As I mentioned earlier, that may mean that we're interacting with our patients through telehealth visits, that kind of thing. But, overall, I think from a cancer diagnosis perspective and the way our treatments are flowing, really worth keeping things pretty much on time and to schedule. And so I don't think anyone should have concerns about there being major compromises to the treatment because of this.
Okay, so are there any pauses occurring for people that are already in treatment, or are you just kind of delaying starting new treatments in terms of that balancing act you were talking about earlier?
Yeah, there's a little bit of both. I mean, for some treatments, especially for patients who have very intensive cancer treatments, such as bone marrow transplants, CAR T treatments, those kind of very intensive regimens, then for many of those patients, we made a decision to delay those treatments simply because, the risks to patients from some of those extremely heavy treatments at a time when the virus is very prevalent, that would simply be too risky. And so we made a decision to delay those treatments until we're confident that we're beyond the peak. So that's a relatively small number of patients whose treatment would have been delayed because of that.
What makes those treatments so risky?
So we give very high doses of chemotherapy along with bone marrow transplant, for example, which means that the patient's immune system is very, very severely affected. So they are very highly at risk of developing infections. And so it would simply, I think, be too risky to treat a patient with that kind of treatment when we know that the virus is so widespread in our community at the moment. And we do know that if we did that in a patient who did pick up the virus, then the likelihood is that they would become extremely sick. So, long story short, the risk of putting the patient through it at that time would have outweighed the benefits. So it's safer to wait until we're more confident about the situation with the virus.
Okay. Well, I know that you have more meetings to get to today. Is there anything that you would like to add that we haven't asked?
I think that my message would be, for now, we are beginning to work very hard to begin to get back to normal. Normal is probably going to look a little different for the next few months. And what I would say to any patients who are with us at the moment and who are coming here for their treatment, like I said, I think that that we are going to rely a great deal on virtual visits for the time being. We are going to try to minimize the amount of time that people have to be here and to wait here. But treatments will stay on time. And, the other thing I would say is that in terms of what you can do, the take-home messages are the ones I mentioned already: social distancing, masks, hand washing. And if you are spending prolonged periods of time at home, which I know many people are, be aware of things that you can do just from a general health perspective that can be helpful. So watch alcohol consumption, don't smoke, try to eat healthily, keep in a good kind of normal routine. We are getting back to normal. It'll take a while, but remember that the virus is probably going to be around for many months, probably well into the fall and maybe even beyond that. So some of the things that, I know many people out there have already been doing, don't relax on those. Do keep up with the distancing and masks and so on, because that's going to be probably the most important thing that you can do for your health over the next few months.
All right. Well, with that, we will go ahead and wrap up and let you move on with your day. But thank you so much, Dr. Sweetenham, for joining us. And thank you to all of our viewers who tuned in and asked great questions. This chat will be available here and on YouTube. So if you want to share this with somebody that would benefit from it, we definitely encourage you to do so. But until then, we will see you next time.
Thanks. Bye.